Okay, just a couple, three terms here. Just review them quickly with you. So, substance medication induced mental disorder, you can read the definition there. Um, what we'll talk about, what will come up number of times over the course of our time together here in this course, is trying to parse the challenge of trying to parse out. Um, what is when people are using substances heavy and regularly, but also have other mental health symptoms outside of a substance that are beyond criteria for a substance use disorder. And so, is it is it a substance induced disorder or illness or condition, or does a person have a other mental health condition for which, and they're trying to self-medicate it with substances and exacerbating their already existing problems. So, and that can be hard to do, and we'll talk about that a good bit more. The only thing I'll say about independent mental disorders is nothing happens independently in the human existence to me. Um, I guess part of this maybe from teaching the integrated health course here, but everything, our physical health, our mental or psychological health, our wellness, and what's happening around us, how we're interacting with the world, and how the inner world interacts with us in turn, uh, our identities, our history, things that have happened to us in the past, things that are occurring in the present. All these things are interconnected with one another that shape who we are, how we interact with the world, how we perceive the world, and certainly impacts our health at every facet. All right. And another mental health condition, just to echo that, the diagnoses we cover in here are absolutely legitimate medical problems and health conditions. And to me, some of them are health or actual injuries versus, a disorder or illness or condition. Like I said, we'll revisit that. Um, but there will definitely be times where a physiological condition is the driver of the symptoms, functioning impairment, and distress that may be going on with the client. A very somewhat classic example of that, classic meaning common and well known, is in the neurocognitive disorder section. We'll look at delirium. And delirium is a presentation where there are multiple and usually very acute psychotic symptoms. But the derivative, the etiology of those symptoms is from something physiological. And a urinary tract infection is one of the most common. So an untreated urinary tract infection, really any untreated infection left alone long enough, can potentially cause a delirium. But UTIs are sort of, particularly in older folks, are well known to be a driver of that presentation, and thus we call it delirium. So, just as an example of another medical condition. All right, so that's it for that.